powerful name in local news. Fox 5 News at noon.
Up next in Health Watch, the new test that's helping bring things into focus for some children. There may be a new way to diagnose children with vision problems earlier than ever. In the first 5 years of life, our brain creates the pathways that we need to see the world around us. That is why vision problems need to be caught and corrected early on. Here's Health Watch reporter Beth Galvin.
This is the head.
Whether Daphne Tanyildiz is drawing pink camels on the concrete or a self-portrait in magic marker, the Atlanta 4.5-year-old loves telling stories.
She likes
To write.
to write. Yeah, these days she likes writing cards to grandma in Turkey, right? And drawing pictures.
And although you can't tell it from Daphne's drawings, she was having trouble seeing the world around her. Her mom, Ezra, says she noticed that Daphne, who's right-handed, sometimes favored her left eye.
While she is taking a picture, she had a little camera of her own. She was using her left eye, and it was odd to me because you probably also realize you use your right eye.
Where is that?
It's estimated about 5% of children under 5 and as many as 20% of older children have a vision problem. And Jenny Pomeroy, CEO of Prevent Blindness Georgia, says when kids can't see, it can have a huge impact on their development.
Vision problems are the leading handicap of childhood. No other problems affect so many children. And we think, oh, we get them glasses. But if you can't see, you can't learn, you can't read, you can't follow what's going on in the classroom with the other kids. And this one?
So to make it easier for pediatricians to spot vision problems,
The house.
Prevent Blindness and the American Academy of Pediatrics have created a screening test for younger children, like 5-year-old Mary Rose Schwarzkopf. Instead of letters, this chart has easy-to-recognize symbols. And instead of machines designed for older kids,
the little children were sitting up here and turning their heads ever so slightly so they could see.
It's scared.
in this test, Nurse Brenda Vickery is watching Mary Rose to see what she's doing with her eyes.
So if a child turns his head or juts his head forward or squints or blinks, that's a clue that there's a problem.
Come here, sweetie.
Mary Rose's pediatrician, Dr. Robert Wiskin, whose practice was the first in Metro Atlanta to start using the new screening test for all 4- and 5-year-olds, says Mary Rose's vision is normal. But the test showed Daphne was struggling because her left eye is much stronger than her right, so it was taking over.
The risk is that if over time, as her brain grew and developed, she wasn't getting clear signals from that eye, that the brain would stop listening or stop responding to signals from that eye.
And she said, where was I going?
Untreated, Daphne could have lost much of her vision in her right eye.
And she gave her one of the balloons.
But with her new glasses, Daphne is now seeing clearly and back to doing what she does best, drawing pictures and telling stories.
And then Maxine gave me a balloon.
Beth Galvin, Fox 5 Health Watch.
The eye chart you saw is not new, but the way doctors are using it is. And Prevent Blindness Georgia is trying to encourage pediatricians to use this method because Jenny Pomeroy says it is inexpensive, easy, and effective. Last week, nurses from 15 local pediatrics offices learned how to do these pre-K screenings. You can learn more about your child's vision at myfoxatlanta.com.